Brenda's Bonkers. Happy Thanksgiving. I'm very thankful for all of you that are watching. This videos give me great joy in doing them. I know I'm a little bit late on sending this one out, but I had some technical difficulties last week, so I couldn't do it. But better late than never. So today we're going to talk about my diagnosis and how I feel about it. So I got diagnosed in 2020 when I was in the VA mental hospital. They must have told me they never told my husband. I don't remember it. But I knew something was wrong. And they were treating me with antipsychotics. So I was getting treatment for it. I just didn't know that I had schizoaffective disorder. In case you don't know what schizoaffective disorder is, schizoaffective disorder is where you have symptoms of schizophrenia like hallucinations and delusions and paranoia. And you also have symptoms of a mood disorder. In my case, it's bipolar, where there's a lot of ups and downs with moods. So that's what schizophrenia or schizoaffective disorder is. So anyways, it continued after I was hospitalized, and it actually had been getting worse. The meds helped, but I knew something was wrong with me. I could tell the difference when the shot would start wearing off. I would start having some hallucinations and delusions. And so I thought I had schizophrenia. So I even put it on a necklace. See, this is my medical alert necklace. I have it. It says my name. It says my allergies. It says that I have diabetes. It says that I have schizophrenia. And it has my husband's name and his phone number. So in case I ever wander off or I'm in some kind of delusion or something, there's something around my neck that will tell them how to get me back home. So I made up the necklace because I was getting bad, but I just kind of let it go. I know the VA, they don't diagnose you very well. It took years for them to diagnose me with PTSD, and I'm talking like 20 years. So I figured that this was the same thing that I had it. They just weren't going to diagnose me, but they had diagnosed me. So fast forward to 2024. In 2024, I had to fill out disability paperwork. I had breast cancer, and the computer systems for the VA had been updated greatly. So I looked on my problem list to fill out the disability paperwork. And on my problem list, it said that I had schizoaffective disorder, bipolar type. This was the first time that I ever heard of schizoaffective bipolar type. But it kind of made sense. And I was glad that I had a diagnosis, especially for the disability paperwork. The more I filled out the disability paperwork, and the more it came back that I was disabled, I realized this is a really big deal. I was kind of scared at first. It gave me fear. There's a stereotype to being diagnosed with schizoaffective disorder and schizophrenia. And so I wanted to learn about schizoaffective disorder. So I started watching videos on YouTube I started doing searches on Google. I started looking up stuff on AI, and it was kind of scary. I knew there was something wrong with me. I've known there's something been wrong with me for, I don't know, at least 10, 15 years. I haven't worked. I don't get disability pay because I haven't worked in 15 years. If I had been diagnosed sooner, I probably would be getting disability. But I wasn't diagnosed until now, until 2020. So let me read my notes. I joined a couple Facebook groups about it, and started learning what other people were going through. I realized that most people on the internet were younger than me, that I was old. To be diagnosed at 46 years old was being really old. Most people are diagnosed in their late 20s, early 30s with this. And I wasn't diagnosed until I was 46. And there really wasn't a lot out there for older people. And I figured, since it wouldn't hurt me at all, and people know I'm disabled, that it's time that they learn what I'm disabled about. So I came out. As I got services and help, and I was labeled disabled, it felt like it was time for me to come out as being schizoaffective. That if other people had come out and done videos and stuff, I could too. I really don't want to be an advocate. I know a lot of these people have turned into being advocates when they came out. But I felt I also lost my therapist. And so this was kind of therapy for me to do these videos. How did I feel about it? I felt like it made sense. I had had this a long time and nobody had told me what it was. So I felt kind of a little bit of relief. But then I kind of felt scared too, because who wants to be the schizophrenic person? You know, what do people think about you? What are the stereotypes? They always think of the homeless person that's always talking to themselves. And I'm afraid of becoming that. I know there's lots of times that it doesn't affect me, because of my meds and stuff like that. And even before I took meds, there was times where I wouldn't have anything. So it's not something that's constant in my life. And I felt that the diagnosis made that. Coming out also, people maybe understand me a little bit more. It's so hush hush, at least in the white community, if you're mentally ill. So I wanted to come out and have people ask me questions about it, or watch my videos and understand what's going on with me, and realize that this doesn't happen to me constantly. That I am just a normal person that have some issues, and know what those issues are. I also feel like I'm helping other people that are older that have this disease. Or not. I guess it's not a disease, it's disorder. Um since there isn't a lot out there for older people, and the young people will become old at some point in their life. It's just my generation doesn't come out on the internet as much. And I want people to see that there are older people that have this disorder. I also feel like I'm broken with the diagnosis. Without having the diagnosis, I was just kind of weird. Or I didn't make sense sometimes. Now I have the diagnosis and it's because I'm broken. I don't like feeling broken. Like something can be fixed. And really, this is a lifelong disorder. It's not something that will go away. It's something that I've probably had for a long time, but I really didn't recognize it. I recognize more symptoms now that I've been diagnosed, and I can blame it on my diagnosis. Where before it was just me, I was blaming myself for things rather than blaming the diagnosis. So, as you can see, I've gone through a lot, and the diagnosis has impacted me. And I hope it's impacted me for the good, though. Especially coming out with it so early after I found out. I'm still trying to deal with it. But, anyways, have a happy Thanksgiving. Enjoy your family. If you don't have a family to enjoy it with, spend the day taking care of yourself. It's a good day to do that. Be thankful that you have that time to yourself to do things for you. Have a good day and thank you. Happy Thanksgiving. Like and subscribe. Bye.